An 8-year-old boy has sudden onset of facial swelling 2 hours ago. He has had no itching or pain other than a sore throat over the last 2 days, for which he has taken acetaminophen. The patient has had similar episodes of facial swelling that resolved spontaneously after a few days. Temperature is 98.6 Fahrenheit, blood pressure is 100/78, pulse is 95, respirations are 24. Exam shows non-pitting edema of the cheeks, lips, and tongue. There is no tenderness or erythema. Which of the following studies is most likely to be abnormal? Okay, so a 8-year-old boy with a history of swelling in the cheeks, lips, and tongue without any itching or pain is going to be suspicious for hereditary angioedema. So he's had similar episodes in the past. As a result, this is indicative of hereditary angioedema. Let's talk about the Kinin system, because we need to talk about this system in order to really appreciate hereditary angioedema. So the main product of the Kinin system is going to be bradykinin, which we will talk about. So the liver is going to produce 3 proteins that we need to keep in mind: factor 12, prekallikrein, and high molecular weight kininogen. And these 3 proteins are going to freely flow in our blood. So here I'm drawing endothelial cells, so we know that we are in the blood vessel. And as I said, these 3 proteins are freely flowing around in our blood. If there is damage to our blood vessel, it can expose collagen tissue. If collagen tissue is exposed, let's write this down: collagen tissue. If collagen tissue is exposed, then it can interact with factor 12 to activate it. So it will convert factor 12 into factor 12A, or activated factor 12. Now, factor 12A can do 2 things. It can either start the coagulation cascade, or it can convert prekallikrein into kallikrein. Kallikrein can then convert high molecular weight kininogen into bradykinin. Now let's talk about what bradykinin does. Bradykinin can constrict smooth muscle in the bronchi, leading to a dry cough. It can be responsible for the signs of inflammation. Okay, it can lead to arterial dilation, which can cause warmth as well as redness. It can increase postcapillary permeability, which results in swelling. And this is a very important thing that bradykinin does that we will talk about. And it also increases free nerve ending sensitivity to pain. Clinically, bradykinin is relevant in the way it is degraded. So bradykinin is going to be degraded with the help of something called inhibitor or C1 inhibitor, as well as angiotensin converting enzyme. Now, C1 inhibitor can be confusing in that it also plays a role in the complement system. But for our purposes, for now, just know that C1 inhibitor is going to be responsible for the degradation of bradykinin. And if there is C1 inhibitor deficiency, then that leads to hereditary angioedema. Now, I'm going to quickly discuss the role of C1 inhibitor in the complement system, because It is relevant in the diagnosis of hereditary angioedema. So C1 inhibitor, what it does is it inhibits the activation of C1, which is very simple. If we have a deficiency of the C1 inhibitor, like in patients who have hereditary angioedema, we're going to have increased levels of activated C1. And the downstream effect of C1, activated C1, is that it activates C4. So what we would expect in patients with hereditary angioedema is low levels of C4 because we have activated C4. So we would have high levels of C4a and low levels of C4. And that is going to be our answer in this question. The question was asking which of the following studies is most likely to be abnormal, and it's going to be serum C4 levels, as I just discussed. Because we have a C1 inhibitor deficiency, we're going to have higher levels of activated C1, which is then going to convert C1 to activate, which is then going to convert C4 into activated C4. As a result, we will have low levels of C4. Now, let's fill this table out quickly. The pathophysiology of hereditary angioedema. So we have C1 inhibitor deficiency, which leads to increased levels of bradykinin. And then this increased levels of bradykinin can lead to swelling, which we see in angioedema. This can be dangerous in that bradykinin freely travels around the blood vessel and it can reach the trachea and the respiratory system, and it can result in life-threatening suffocation of the patient. So that is why it is important that we take angioedema seriously. The presentation is going to be with swelling and dry cough. As we said, it leads to smooth muscle constriction in the bronchi, which leads to dry cough. And the diagnosis is made with low C4 levels. The treatment is going to be simple. We're going to give the patient C1 inhibitor concentrate because they have a deficiency in the C1 inhibitor. Now, answer choice A and B is eosinophil count and serum IgE level. So these are going to be high in allergic conditions. In allergic angioedema, for example, in anaphylaxis, the cause of the angioedema is different in that it is going to be due to histamine release from mast cells. What we would expect is we would also expect the involvement of other organ systems. We would expect something like hypertension. We would also expect itching or pruritus, as well as hives. And of course, swelling. Answer choice D is serum C8 level. C8 is going to be involved in the formation of the membrane attack complex. And this is going to be important for the lysis of pathogens. This is also going to be wrong. And answer choice E is serum IgA level. So there can be selective IgA level deficiency, which can lead to increase in risk of developing angioedema due to anaphylaxis. And the reason why this answer choice is going to be wrong is because we would also expect the involvement of different organ systems. And the risk is going to be only increased with blood transfusions. Only increase in risk from blood transfusions. And as I said, we would also expect the involvement of other organ systems, for example, hypotension, bronchospasm, things like that. So the best answer is going to be answer choice C, which is a decrease in serum C4 level.